Thank you for tuning into the Shikama Live Show with your host, Shikama. You didn't care when they told you about the people in Africa dying. You didn't care about the people over in Asia dying. You didn't care when they told you about the people in Eastern Europe dying. Well, now we have veterans inside of the United States dying because the VA is run by bureaucrats and not by doctors. This scandal is supposedly threatening to engulf the Obama administration because finally people, Democrats, white and black, are finally taking notice that the king has no clothes, that Obama is lying, and that his administration is run worse than the mafia. The mafia would be an upgrade compared to this scoundrel who sits on the throne of the United States. And that's exactly how he sees it.
A deputy chief of staff, Rob Neighbors, to oversee the VA's audit. VA hospitals around the country allegedly kept secret waiting lists designed to hide how long veterans waited for care.
Amid contrived outrage over Benghazi and the improved fortunes of its healthcare reform, the Obama administration could be facing a genuine scandal about its treatment of military veterans that has the potential to attract broad political condemnation of its competence. The Department of Veteran Affairs, VA, is facing mounting evidence that some of the hospitals it runs have been keeping two sets of books to make it look as if they were reducing waiting times to see a doctor. More damning, the department is investigating the claims of a whistleblower doctor in Arizona that dozens of patients at one hospital died while they were languishing on a hidden waiting list without ever being given an appointment. Richard Griffin, the department's acting inspector general, admitted on Thursday that its review could lead to criminal charges. In the first political casualty of the scandal, Robert Petzel, the department's undersecretary for health, resigned on Friday. If the evidence of mismanagement continues to accumulate, the Obama administration will find itself not in another partisan knife fight, but under fire from both parties in a Congress where the uniformed military is venerated. The veterans' healthcare scandal is, in part, one of the unintended consequences of the wars in Afghanistan and Iraq, which have created our 9/11 generation who have served with honor in more than a decade of war, as President Barack Obama described them on Thursday. More than 970,000 veterans from those wars have filed disability claims, taking the total enrolled in the VA system to 8.57 million by the end of 2012. And before I continue, they have on record, with only 24 states reporting, 20 veterans commit suicide every month. They are not getting the health care that they need. They're not getting the psychological training that they need.
Whistleblowers and investigators in at least 5 states say officials are concealing the long wait times that veterans endure for crucial medical tests. In Phoenix, where delays in care may be linked to up to 40 deaths, dozens of veterans and family members attended a town hall meeting to complain.
Treatment delayed is treatment denied.
It is virtually impossible to get a hold of somebody over the telephone.
At the same time, the healthcare system is dealing with the fact that many of the 6 million veterans from the Vietnam era are now reaching the age when they start to require a lot of medical services. In 2010, the administration expanded coverage to exposure from Agent Orange, the chemical used during the war in Vietnam, prompting another surge of claimants. The result has been a constant struggle to meet new demand despite big spending increases. The budget for the VA has risen from $73.1 billion in 2006 to $153.8 billion this year. However, the number of outpatient visits at its facilities has increased from 46.5 million in 2002 to 83.6 million in 2012. Quote, "I am amazed this is still happening given the big increase in resources that the department has received," said Philip Carter, a former Army officer who researches veterans issues at the Center for a New American Security in Washington. The VA, which runs 152 hospitals and 817 outpatient clinics, has long suffered from delays and a dysfunctional bureaucracy. In 2010, it introduced a new appointment system which promised a 14-day wait for an appointment with a primary care doctor or a specialist. While there have been reports for several years that the new waiting line system was being abused, the subject really began to gather steam 3 weeks ago when CNN interviewed Sam Foote, who had recently retired as a doctor after working for 24 years for VA hospitals in Phoenix, Arizona. He said that as many as 40 patients have died after being placed on a hidden waiting list that could last for up to a year, while officials at the hospital shredded documents and faked evidence to make it seem as if waiting times were under control. 3 officials in Phoenix have been put on leave, although McGriffin said there was no evidence yet the patients had died because of delayed appointments. Since then, whistleblowers have allegedly similar practices at least 7 other VA hospitals around the country and claimed the officials at the hospitals were sometimes paid bonuses for reducing declared waiting times. The political impact of the scandal has been somewhat muted so far, in part because the respect still enjoyed by the Veterans Affairs Secretary, retired 4-star General Eric Shinseki, who was himself wounded twice in Vietnam, appearing before a Senate hearing on Thursday. Mr. Shinseki received pointed questions, but in a tone more respectful than almost any other cabinet member would have encountered. "I am mad as hell," he told the committee. What a liar. However, if Congress, he doesn't care. He doesn't care. Nobody at the VA cares. And I have people on record saying that the VA is probably the worst run system ever. That's before when they were a civilian until after when they became a veteran. However, if Congress concludes that efforts to manipulate waiting lists have become systemic, or the allegations that patients died while waiting for phantom appointments are proved, Mr. Shinseki will face huge pressure from both parties to resign. He should be put in jail, not resign, along with everybody in his staff and the staff under them and the staff under them. It needs to be completely overhauled.
Secretary Shinseki will be asked to explain the serious problems within the VA system of medical appointments.
There's something just not right at the department.
Senator James Moran of Kansas has asked Shinseki to step down.
It seems to me that he is unwilling, unable to provide the necessary leadership to change the culture, to reduce the bureaucracy.
My evidence is showing that the doctors are the ones who are really taking a beating in this, and the ones who are not making policies but are having to adhere to this. This is disgusting, and this entire administration and this entire agency should be completely overhauled. Give veterans stipends and have them go to any specialist that they want, any doctor that they want, and the American taxpayer will pay for it. I know plenty will agree to that instead of having this bloated $200 billion a year budget that does absolutely nothing but kill the very people that it's supposed to be serving. Would you agree to do away with the Veterans Administration and instead give veterans stipends to go to a doctor or the specialist of their choosing. That would be the better alternative. Tell me what you think below. Thank you for watching the Shikama Live Show.